hip pain is becoming more and more common. People are living longer. People have higher expectations of what they want in throughout their life, particularly in retirement. When I see patients, they often come in asking me about hip pain. What they may feel is hip pain doesn't always start within the hip joint itself, but is pain in the hip region. That can be caused by any number of causes, mainly the hip, but also back pain, muscle pain around the hip joint, and even problems in the pelvis itself. Patients who typically present with arthritic hips will present with pain in their groin particularly. They also have pain at rest, pain at night. They might resort to using a walking stick. They can walk less far and they become reliant on painkillers. Typically at the first sign of hip pain, you don't necessarily need to come and see a specific orthopaedic surgeon. Many of the patients I've seen have managed their hip pain perfectly well for some time at home. They would manage with pain relief, modifying their activities, or even resorting to using a walking stick. They'll often start by seeing a physiotherapist or their general practitioner. If none of those things are really cutting the mustard, that's when they'll find their way to me. Hip pain can be a little tricky to diagnose, and that's my job. I would always take a really detailed history from the patient, find out exactly when it started, how it started, how it's affecting them now, and what the effects on their quality of life are. Once I've done that, I'll examine the patient, and the combination of a decent history and a good examination will tell me the diagnosis in about 95% of cases. Once I've got that information, I will usually order an X-ray on that patient, and very rarely further imaging in the form of something like an MRI or a CT scan. And they will always give me enough information to make a diagnosis. Surgery isn't always necessary to fix a problem in the hip. It's commonly manageable at home with walking aids, modifying your activities, staying active. Low impact exercise is particularly recognized as being good for your hip. And by low impact, I mean not running on a road, but using a bicycle or even swimming. If those aren't working, of course, we may well need to look for a surgical solution. And that's particularly common in patients that I see who have osteoarthritis. That's the wear and tear form of arthritis. Other conditions that I treat with surgery include inflammatory arthritis, and those are things like rheumatoid arthritis, and also other causes like trauma, a fracture, or something called dysplasia, which means abnormal growth of the hip. So when I treat patients with hip pain, both the patient and I will come up with a plan that suits the patient. It can often involve a trial of non-surgical treatments, which include physiotherapy, painkillers, activity modification. If those haven't worked or the patient's already tried them, then we'll come up with a plan together that usually involves a surgical solution in the form of a hip joint replacement.